you have heard of the book from the 90s, Men Are From Mars, Women Are From Venus? Yes. So let's take that idea with a twist. Imagine that you're a man from Mars traveling to the planet Venus, a planet run entirely by women, by the way. And a few days into your trip, you start to feel sick. So you decide to go to one of Venus's top hospitals. Now, these Venetian doctors are brilliant, but they're baffled. Your symptoms don't match any of their medical textbooks. So they call you atypical. And then they default to the only Martian biology they had studied: male reproduction. They give you a testicular exam. That's it. And after your tests come back, they say, good news, everything's normal. And they send you on your way. Sounds ridiculous, right? Yet this is how millions of women experience healthcare every day. The only difference is the Venetians probably apologized for that awkward exam. Women on Earth, they don't get an apology. They get dismissed, misdiagnosed, simply because medicine was built on how male bodies work. So why did this happen? Before 1993, women were excluded from most medical research in areas like cardiology, neurology, and pharmacology, because researchers believed two things. The female biology was too complex to study, and men and women were essentially biologically identical except for our reproductive parts. So they defaulted to studying diseases in men and simply applied their findings to women as though women were little men. But when women were included in medical research, it was limited to breast and reproductive health, the parts that are covered by a bikini medicine. Now, when I was an internal medicine resident, we were taught to treat chronic disease as if the symptoms and the treatments were the same for both men and women, but they aren't. In fact, residencies didn't officially start treating that women can have pain symptoms that are different until 2021. I have t-shirts older than that. Now, we can agree that men and women are different, right? Just take the underwear theory. Men don't go out to buy new underwear. They only replace the ones that disintegrate. Women, on the other hand, we have entire department stores built around finding the right fit, the best support, and the ones that look good. I want you to imagine a man going into a department store to get professionally fitted for his underwear. So if we can agree that men and women are different, why does medicine continue to use a one-size-fits-all? Women can have different symptoms than men. Take heart attacks, for example. Women don't classically present with that crushing chest pain you see in Hollywood movies. According to the American Heart Association, women are more likely to have fatigue, nausea, abdominal pain. In fact, research that was published in the journal Circulation 2018 found that women under 55 were twice as likely than men to be misdiagnosed while having a heart attack and sent home, increasing her risk of complications such as heart failure and even death. Now, there are certain diseases that women have higher risk for. Did you know that 4 out of 5 people with osteoporosis are women, according to the National Osteoporosis Foundation? Did you know that 4 out of 5 people with autoimmune diseases like lupus are women, according to the studies of the NIH? And 2 out of 3 people with Alzheimer's dementia are women, according to the Alzheimer's Association. So it's not just about symptoms and risk. We are anatomically different as well. You might not know this, but a woman's colon is longer than a man's. And this wasn't published until 2021 in the American Journal of Gastroenterology. So ladies, when it comes to colon, size matters. Okay, so why does all of this matter? Because when medicine fails to recognize that diseases affect women differently, we dismiss symptoms, we delay diagnoses, and we prescribe medications that are not right because women metabolize drugs differently. And women deserve better. I deserved better. So when I was in my 20s, I was juggling 2 residencies at the same time. I was recently married, I was pregnant with my first child, and on a routine OB visit, my doctor noticed a lump in my neck. And he said, "You should go see an endocrinologist." So I did. And the endocrinologist said, "It's probably just hormones, normal in pregnancy." And I nodded, because I didn't want to question the doctor. So let me ask you something. Have you ever felt like there was something wrong in your body, but you were afraid to question the doctor because you didn't want to seem dramatic or difficult or demanding? Well, you're not alone, and you're not wrong for wanting answers. So I carried on over the next 9 months. I was working my residency, I delivered my baby, I lost the pregnancy weight, and the lump in my neck, it grew. So I went back to the same endocrinologist, and he said, "It's probably just hormones, normal in postpartum." But something shifted. I knew something was wrong. So I decided to get a second opinion. I went to one of my attending physicians. He was kind. He listened. He examined me. He ordered a biopsy. And then he called me that Friday night to tell me, "It's cancer." So when I heard the word cancer, I went into survival mode. Instead of slowing down, I pushed harder. I worked through my first surgery and my radiation treatment. The following year, I found out the devastating news that my cancer had spread to my lymph nodes, and I needed a second surgery. And the following year, it had spread to the opposite side. I needed a third and then a fourth surgery. I had to face the realization that I was not just a doctor, I was also the patient. I knew what it was like to be on the other side of the table. I knew what it was like to have questions. I knew what it was like to be scared. And it was feelings that were much more than just fear and sadness. I was angry. And these are feelings that I realized I shared with so many women that I had treated over the years. And it broke my heart when I heard them say, "I knew something was wrong, but they said it was hormones." I've been to so many doctors and they can't figure out what's wrong. And then it hit me. It wasn't just me, and it wasn't just them. It was all of us. So you might think that the problem is that doctors don't listen or that medicine is biased, and that may be true. But what if I tell you that the truth is more fundamental, that medicine has failed to study women properly? So women have been included in research since 1993. But it wasn't until 2016 that the NIH required researchers to disclose their results based on gender. That's male and female. That's 23 years of data where we have no idea about female-specific outcomes. So think about it. Our medical textbooks, our diagnostic tools, and even our definition of normal is based on male bodies. So when a woman presents with symptoms that don't match our textbooks, we call her atypical. But how can something be atypical when it literally affects half the population? Let that sink in. Now, there is good news. We are starting to close the gap in medicine. There are thought leaders that are finally asking, what if we study women as women? At the Mayo Clinic, I'm working with researchers and we're using artificial intelligence to study mammograms, not just to detect breast cancer, but to detect early heart disease in women by analyzing the patterns of calcium deposits in the breast arteries. So your annual mammogram is not only going to help you find breast cancer, it's going to give you an annual heart screening. How amazing is that? Now, research does take time, and as we are just catching up in women's health, this new information can take years to trickle down into medical textbooks, residencies, and clinical practice. Many doctors may still rely on outdated information. So the question is, what do we do? And the answer is self-advocacy. Something that I learned to do during my cancer journey. And here are 3 simple steps that I talk about in my book. Step number 1, know yourself. Trust yourself. You live in your body every day. You are your best doctor. So be an active participant in your health. If you have pain, write it down. Where does it occur? When did it start? What makes it better? What makes it worse? Show up prepared. Second, don't be afraid to ask questions. Your doctor may not have all the answers. It may take a few follow-up visits and time to figure things out. Medicine is imperfect, but the key is communication and patience. And third, seek knowledge from reputable and reliable sources. Find specialists that are experts in the field. Think about the women that came before us, our mothers, our grandmothers. They deserved better answers than they got. Now think about the women to come, our daughters, our granddaughters. They will get better answers because of what we choose today. So choose to advocate for yourself. Share this information with other women in your lives. And most importantly, partner with your doctor. Keep the conversation open as new information and research emerge. This is how we move together, beyond the silence, beyond the assumptions, beyond bikini medicine. Thank you.